Welcome to the CannMed Coffee Talk podcast, where we talk with the leading minds in cannabis science, medicine, cultivation, and safety testing. I am your host, Ben Amirault. I am the Senior Marketing Manager at Medicinal Genomics and proud member of the team that puts on the CannMed Summit. First, I want to thank everyone who submitted an abstract for the CannMed 26 Innovation and Collaboration Summit. We received a lot of really excellent submissions, which have been turned over to our advisory board for their review. We will notify the presenters who we select for oral presentations in December, with plans to announce the final lineup in January. At that time, we will also open up registration for the summit. Now, capacity at the resort is limited, and we are expecting a sellout, so please do not wait to reserve your ticket this year. If you go to CannMedEvents.com, you can check out our ticket packages and sign up for notifications so you don't miss when tickets go on sale. We also recently announced details for the CannMed 26 Medical Practicum, which features some new advanced topics such as cannabis and pregnancy, sports and recovery, pharmacokinetics of different product formulations, and more. But our guest today will get into all of those details in just a minute. That guest is Dr. Bonni Goldstein. Bonni is the medical director of CannaCenter's Wellness and Education, a leading cannabis medicine specialty practice, and she's the CEO of GoldsteinWellness.com, an educational platform dedicated to helping licensed healthcare professionals incorporate medical cannabis into their practice. Bonni has evaluated thousands of patients for medical cannabis treatment with a special focus on treating children with intractable epilepsy, autism, and cancer. Bonni has also served as the medical director for the CannMed Medical Practicum since 2022. During our conversation, we discussed the exciting updates to the CannMed Medical Practicum, findings from a California medical cannabis study showing diverse patients, high efficacy, and research gaps, the importance of medical guidance when using cannabinoid therapies for complex conditions, Goldstein Wellness as a resource for clinicians and patients, providing education, patient-clinician connections, and vetted product access, and more. Before we get to my conversation with Bonni, I'd like to thank this episode's sponsor, the Society of Cannabis Clinicians. The Society of Cannabis Clinicians is a nonprofit professional association of physicians and other healthcare providers. It provides continuing education for clinicians, patients, and all concerned about medical use of cannabis and best practices in clinical care. SCC physicians have been monitoring cannabis use by patients for 20 years and have compiled a wealth of clinical evidence and treatment strategies that they believe will be validated by clinical trials in the years ahead. To learn more about SCC and join, visit cannabisclinicians.org. Okay, and without any further ado, please enjoy my conversation with Dr. Bonni Goldstein. Good afternoon, Bonni. Thanks so much for joining us on the podcast again.
Well, it's great to be here, Ben. Thanks for inviting me.
Of course. We have a lot to catch up on. First of all,
Sure do.
We are very excited that you will be leading the medical practicum at CannMed 26 once again, along with Dr. Dustin Sulak and Dr. Ethan Rousseau. The practicum, it's always a highlight of the summit, and traditionally it's provided some excellent foundational information, including the endocannabinoid physiology, cannabis pharmacology, dosing, etc. But for next year, we're going beyond the basics. So I was hoping you could talk a little bit about the new format and what attendees can expect.
Yeah, it's really exciting. We decided to change it up just to delve deeper because we have a lot of research and a lot of clinical experience amongst the faculty that we want to share in just a deeper dive. And so we will be kind of revisiting the endocannabinoid system and some of the foundational pharmacology and um, other aspects of endocannabinoid system and the plant and how they interact, but in a very condensed way. I'm really excited because we have Dr. Russo joining us. And he was the pioneer who hypothesized the idea of the clinical endocannabinoid um, um, deficiency syndrome, about 20 years ago. And he is going to give a talk on that hypothesis and what we have discovered over the last 2 decades that support that hypothesis. So it's really exciting that he's going to be able to, and we're calling that clinical endocannabinoid deficiency revisited. So I'm really excited about that. We're going to focus too, and I'm going to give a talk on minor cannabinoids. This is a huge part of my medical practice. I have patients who are not using THC or CBD and are experiencing life-changing results. And that is like, when people might say, well, what are you even talking about? So CBDA, CBG, CBN, CBDV, and I probably have joked with you before, my husband calls it alphabet soup, but
Mm-hmm.
these cannabinoids are non-impairing. They are incredibly beneficial for inflammation, neuroprotection, antioxidant, anti-seizure, anti-cancer. I mean, there's all of these cannabinoids have so many properties. We also have Dr. Dustin Sulak talking about chronic pain, and he's going to focus on clinical strategies for patient success in challenging cases. Really excited about that. We're going to go through the deep dive of cannabinoids in the immune system, which is a huge topic. I'm going to be doing that one. It's hard to cover in 45 minutes, but I'm going to give it my best. And then Dr. Russo again is going to cover neurology, including Alzheimer's and ALS. And remember, he's a neurologist by training, so it's a really nice perspective that he gives us. And then a couple other topics. We're going to cover sports and recovery, which is great. We're going to cover pregnancy and lactation.
Mm-hmm.
We're going to cover cannabis and psychiatry because there's a lot of controversy there. It's not controversial to me, but it is in the medical community. And then we're also going to cover product formulations because we realize that when somebody is new to this, they
Yeah.
may not understand how these products are formulated, what the differences are in terms of base carrier oils, in terms of nano versus non-nano versus just even, how they're extracted. And so we feel that that's a really great way to go. And then for some fun stuff, we are including a pre-test and a post-test that we're going to ask participants to participate in. And by submitting those, people will be entered to win some fun giveaways. So we're really excited about the upcoming practicum. And I just think it's going to be a wonderful day of education and networking and, again, trying to expand really what we're seeing in clinical practice. So much more than just, I can't sleep or I'm anxious. There's just a whole slew of other topics that need to be included.
Yeah, no, we are very excited. We always are. The practicum, like I said, it's always a highlight. And I think it's always, even though it's a full day practicum, it's always so hard to fit everything in. So I think it's great that we have this new approach. And we're going to be diving into some of the newer topics or some of the ones that haven't been covered before. But we're also going to make recordings of the previous practicum available to attendees too. So even if you are still new to cannabis, you can get that foundational information and come get the new information. And if you've come before to the practicum and are looking for something new, we have that for you as well. So I think it's going to
Yeah,
be
we
awesome.
got you covered. Yeah, we got you covered either way.
Excellent. All right. So now that's out of the way, I did want to talk with you about a new study that I know that you've been working on. I don't think it is published yet. You were telling me there's a ton of data you still have to comb through. So I'm excited to talk with you about that. It's all about the state of medical cannabis in California. So tell us about the study and sort of the reasoning behind investigating this.
Sure. So I partnered with three other cannabis clinicians, Dr. Jeff Hergenrather, Dr. Lori Volan, and Dr. Sherry Yafai, all of whom practice cannabis medicine like I do. And we got together, and what we wanted to do was to look at what patients are still, or what individuals are still seeking medical guidance or approval for cannabis use in California in the what we call the post-legalization era. So just a quick review, California was the first state to pass medical cannabis in 1996, the Compassionate Use Act. And then in 2016, there was a ballot, a proposition on the ballot for legalization, which was voted in. And in 2018, adult use, other terms, recreational use, became the law here. And what we did see was many medical cannabis clinics that were helping patients just disappeared, because many adults, and I'm not saying that they were not medical patients, they were. It's just that once you kind of figure out how cannabis helps you, it is helpful to have input if you have ongoing needs with your doctor. But like, for instance, many of my adult patients, they had it dialed in. They knew what they were taking. They were taking their CBD combo during the day, a little THC at night. It's no big deal. It's just what they do. It works. There's no side effects. They're not going to the emergency room. There's no overdoses. And I know I still have many that still see me and want to stay under my medical approval, but many patients didn't come back. And I think there are a lot of clinicians experienced that. Many clinics closed, which made it more difficult for those people new to cannabis after 2018 to find a clinician in their area to be able to help them get started. Although I appreciate dispensaries and I appreciate all the work that bud tenders do, it doesn't substitute for true medical advice, especially for more complex patients who are on medications where there may be drug-drug interactions, or other concerns, like an elderly person living alone needs to go through cautions, and you want to educate them about side effects and how to tell their doctors, right? And so these are services that doctors like myself and my colleagues perform. So we partnered with UCLA, Dr. Tim Fong at UCLA, and we surveyed patients in our practice. And we had 604 patients return surveys amongst the four clinical practices. And they answered questions on basic stuff like age, their gender, their diagnosis. But we delved into, what are you taking? Mm-hmm. How much are you taking? Have you been able to eliminate or reduce other medications? And if so, which ones? Have you had barriers to access to your medications? Have you had side effects? And if so, how did they resolve? We also asked an open-ended question, which was, tell us about your cannabis medicine experience. So we gathered a huge amount of data, and we are getting ready to publish the first paper. It looks like we are going to break it up into multiple papers just because it's so much. And I just want to point out, too, a couple of things. So one is, when we read papers now, we get a lot of papers that come out, the word cannabis is there. Mm-hmm. Well, what kind of cannabis are people using? Is it THC? Is it CBD? Is it CBG? Is it CBN? Is it all of the above? Right. So as a clinician who's always scouring the literature to learn more so I can help my patients and make good decisions with them, it's very frustrating when you read a paper and it just says medical cannabis.
Yeah.
What does that mean? It means it's an umbrella term now. It is no longer, we cannot assume it's just THC or just CBD.
Well, then there's the route of administration too, right? Is it an edible? Is it a tincture? Is it inhaled?
Exactly. And what's so interesting is that it's, and also like cannabinoid hyperemesis syndrome, which I know at the last CannMed had a wonderful panel, and which is, online if anybody wants to listen to that panel. It's a wonderful recording. But so is it cannabinoid hyperemesis, or should it be THC hyperemesis syndrome? Because I have not seen CBG do that. And I have not seen CBN do that. Like, so really, I think we need to start being a little bit more specific. And that's one of the things that we trying to do with our report is to dial in on exactly what the medical cannabis patient looks like. Why are they pursuing care in California in a post-legalization era? And this will help policymakers, manufacturers of products, other clinicians, and hopefully patients as well to see what conditions are being treated and to look at the side effects. We even asked the question if you have you ended up in the emergency room due to cannabis medicine, and out of 604 patients, I think it was one.
Mm.
So, which is significantly lower than when you look at unsupervised use of cannabis. And I can't tell you how many people ended up in my practice prior to 2018 who did get did get a medical letter, but never got any supervision, never got any advice, went in, bought something, and overdosed
Oh,
and
wow.
ended up in the emergency room. And that happened quite a bit. And we're seeing a lot of that now, especially with elderly. Our older adults are accepting of cannabis. They are interested in cannabis as an alternative to medications that are a little bit more harsh or that have difficult side effects. But dosing is so important. Understanding the route of administration, as you bring up, is so important. So many elderly people, I just want a little gummy. Well, that little gummy may put you in the hospital if you don't know that you should cut it into quarters first.
Yeah.
Don't eat the whole thing. So I think it's very important to put this information out. What does the medical cannabis patient look like?
Great. So I know every state's sort of different. So I'm curious, what is the situation in California like? Is there a difference between medical and adult use in terms of what types of products they have access to?
Well, there's a theoretical, yeah, but it seems that pretty much you can buy anything you really want. There are some products that the manufacturer says, this is a medical product,
Hmm.
right? Um, or and we also have some restrictions on how much THC you can buy all at once in terms of milligrams in one purchase. But I have seen that isn't always followed, and there's really not. It's very blurred lines. It is not ideal, if you ask me. Unfortunately, the way that the system has unrolled here in California is that the regulatory structure has made it very difficult for dispensaries to exist and to pay their suppliers and to pay their employees. And if you can't write off expenses because of the Schedule One status that's ongoing. Um, and what has happened, unfortunately, is that many of the more what I would call medical products, like I don't look, a gummy can be medical or it can be adult use recreational. I mean,
Hmm.
it's kind of how you use it, right? And so the products themselves, but let's just say in terms of THC, there used to be many low dose tinctures available so that somebody could take a couple of drops and get 1 milligram.
Hmm.
Now they're so concentrated that one drop is 3 to 5 milligrams. And I know that doesn't seem like a lot for some people, but for a newbie,
Oh, yeah.
for a baby that with cancer that I'm taking care of, or my 92-year-old auntie, we want to be able to have that low dosing. And some of those products have disappeared. And I will say that was reflected in some of the comments that people shared in their uh, in that open-ended question that we had on our survey, is that they could no longer find products, or that the manufacturer that they relied on went out of business, or only now has certain types of products available, like highly concentrated products that are not of use to them.
Mm. Interesting. And were you also looking into kind of where they're getting their products to, whether it's online versus a dispensary or?
We did. I haven't tallied up that data just yet. We're getting there, but it
Yeah.
looks like, we have people buying products at licensed dispensaries. Some people did say growing their own. Some people said unlicensed dispensaries. Some people online, like hemp suppliers. Some people said that they were getting it from like CBD stores, like brick and mortar stores that are CBD stores. So really, people go where they need uh, to get their medicine. It's their medicine, and there's no reason that we should, one, continue to criminalize these patients, or two, make it more difficult. That's the last thing these people need.
Yeah, no, and I know you talk about regulations, and I know that there's been some new regulations or new bans going on in California that's um, restricting access to certain products as well, right?
It's true, yes. The kind of what we're many different names. I've heard a thousand names for these kind of converted hemp to THC products,
Hmm.
intoxicating hemp. Some people call them. Some people call them frankenoids or hempanoids. Um, but look, I'm into the natural compounds from the plant. I never recommend any of the synthetic or semi-synthetic products. They've We know that when somebody takes CBD and converts it to THC, that there are some unknown contaminants in there, and there are now a number of published papers showing some of the really um, dangerous side effects, like irreversible depression.
Oh, wow.
There's a case of a person who lost their vision. There's a case of a number of cases of people who had suicidal ideation. Um, in general, natural cannabinoids in reasonable doses don't do
Don't
that,
do that. Yeah.
right? And so, why are we, apart from people making money, which is really what I think it's all about? I know there's people interested in some of these other compounds, and maybe down the line they may find some medicinal properties, but to put something in your body that potentially can give you an irreversible side effect. And that's one thing I'll tell you about in terms of cannabis. Even those patients with cannabinoid hyperemesis syndrome, if you stop using cannabis, the symptoms go away.
Right.
And so we know with cannabinoids in general, I have yet to meet anybody permanently damaged, although I'm sure there's some people saying, my kid smoked a lot of pot and he's, damaged himself. I think that's a little bit more than just cannabis itself. Um, but certainly under medical supervision, we don't see that.
Right. All right. So let's dig into some of the findings. At least I know you said you still have a lot of data to crunch, but what are some of the findings you can share, and were there any that really kind of stood out or surprised you?
Sure. So we had our youngest patient that responded, caregiver responded, is 8 months old. The
Oh,
oldest
wow.
patient that responded was 99. So we have this very vast age range. And what's interesting is that in the medical cannabis practice, we see what we call a bimodal distribution. So we have this peak in pediatrics, kind of evens out in the middle years, and then
Hmm.
we see a peak again in seniors or in older adults.
Hmm.
It's those two ends of life that seek help. Even though we still had a fair amount in the middle, it really peaked there. We saw a male dominance in the pediatric population, and that's interesting because that
Hmm.
correlates with the male dominance of autism,
Mm-hmm.
which is a big part of our practice. That was, I think, the fifth most common diagnosis. And then we saw a female predominance in the older patients, which
Hmm.
may reflect, one, longevity, living
Yeah.
longer than their
Yep.
male counterparts. But also, when you go through the literature, you will see that there is a female predominance of chronic pain in the seniors, of anxiety, of insomnia. And so that kind of correlates with uh, the sex distribution correlates with what we know in terms of underlying illness. It's really
Hmm.
interesting. We had, when we asked about your duration of medical cannabis, we had patients that were new, so under 1 year, that they had signed up with one of the clinicians, all the way to 33 years.
Wow.
So, and I think the average was somewhere, or the mean was somewhere around 7 years. So this is longevity, and this is a population. When we look at research, you don't see this population of, like, where you're investigating someone who's been using cannabis for 20 years, right? You just don't really, except when they're looking at harms. That's the only
Mhm.
time. But what about benefits? What about medicinal benefits, right? So that was very interesting. About a fourth of our adult patients between the ages of 18 and 64 had caregivers help them with the survey. And I think that
Hmm.
reflects chronic and serious illness. And that's not one of the peak groups. That was one of the, as part of that bimodal, it was like less overall people. But it was interesting. Um, in the seniors, it was about one fifth of the people over 65 were or had a caregiver help them, which I was a little surprised about that it was less than the younger population.
Right.
But remember, if you're under medical supervision, it's probably because you are not, you're unwell, right? You have a serious illness. Of course, in the pediatric population, like 97% had the caregiver fill out. We had a few teenagers that were able to do the survey on their own. Um, Very interesting. 56% of patients had more than one diagnosis. So these are people with managing more than one illness. 15% of our patients had four or more diagnoses,
Oh, wow.
serious diagnoses. So again, this is who is coming to a cannabis clinician, and it's evident that it's higher acuity. And I'll tell you, I picked up on this. So this supports what I picked up on years ago in 2018 when the adult use kicked in. What I saw in my practice was higher acuity, meaning those patients coming in that were that had more serious illness. Um,
Yeah.
Prior to that, and what I had noticed early on when I first started working in this field in 2008, was that many people came in who were functioning. They're going to work, they're participating in their life, they were using cannabis illegally. It was helping them with their chronic back pain, got them off opioids, or with sleep, got them off sleep aids, or with anxiety, got them off benzodiazepines. And the reason they came to see me was one, they're medical users, but two, they wanted to participate in safe legal access. And that's what you needed was a doctor's letter,
Yeah.
right? But I also think the reason that we're seeing more a higher acuity of patients now is just the idea that we have a ton more research, right, that supports this. We have definitely more doctors that might say to someone who is not doing well on opioids and benzos or whatever and is uncomfortable prescribing more of these medications that can actually kill you or make you an
Mm.
addict. They're like, maybe you should consider medical cannabis. I don't know anything, but go see this doctor,
Right.
right? And so I think there's just more acceptance in the last two
Yeah.
decades.
Yeah, and I would think, those higher acuity patients, I mean, it's a more complicated problem to solve, right? I mean, if you're someone who's struggling with sleep or anxiety, you might be able to find the strain or find the product that works for you on your own. But if you're
Absolutely.
managing multiple conditions, you need guidance from someone like you.
That's right. And what's interesting is that our top three diagnoses correlate with many other surveys: chronic pain, insomnia, and anxiety. But what I have always said is that when you take all other diagnoses, inflammatory bowel disease, dementia, epilepsy, whatever, they can boil down to chronic pain,
Right.
anxiety, and insomnia, because that's what happens when you're ill, is that you get,
Exactly.
two out of the three or something like that. So yeah, so chronic pain was our number one diagnosis. It was the a majority of 65 years and older made up that group. Anxiety and insomnia were the next two, as I've mentioned, and then epilepsy and autism. And
Mm.
that reflects the fact that three out of the four clinicians do see pediatric patients. We're comfortable with seeing children who have these challenges. And so the three of us kind of attract those patients. So I'm not surprised that that was part of our population or our top five diagnoses. Psychiatric diagnoses, the neurologic diagnoses spanned everything. I mean, it was dementia, Parkinson's, Alzheimer's, uh, all depression, bipolar. I mean, and we saw everything between neurologic and psychiatric.
Mm.
We had 15 patients who had fibromyalgia as their number one diagnosis. And interestingly, all of them, and we did have a question about efficacy, every single fibromyalgia patient rated it as very effective.
Hmm.
Whereas all the other conditions, there was many of them rated as very effective or effective, but we had a few that was just somewhat or not effective, very low numbers. I would say that I think it was 85% reported very effective or effective in our overall. And
Hmm.
what's interesting about that number, Ben, is that I published a paper back in 2017 along with Dustin Sulak and Dr. Russell Sinedo, who's a neurologist up in Washington State. And we looked at patients using cannabis for epilepsy, and we found 86% efficacy. And here, this is 85% efficacy. And when you go through the literature and you comb through, you'll see that number a lot.
Hmm.
That where it's in the autism studies, you see around 80% report very effective or effective. So it's really interesting that we see that number over and over again. And again, under medical supervision, you are more likely to find what works, especially if you have a more serious condition. I'm going to share too. Let me just share some other things here. Let me just pull it up here. So, patients under 20 years of age, can you guess? Can I put you on the spot?
Sure, please.
What method of use was most common under 20 years of age?
Inhalation.
No, tinctures.
Interesting.
94%. Because remember, we're treating epilepsy, autism. You need the
Okay, yeah. I mean,
versatility.
I
Yep,
was thinking
makes
like
sense.
teenagers, but you're
Oh,
right.
teenagers. No,
That does
yep.
include
Right,
pediatrics
right,
as
right,
well.
right. So we're talking about epilepsy, autism, and other conditions too in pediatrics, but 94% use tinctures. And it's, again, because of the versatility and dosing, you can really narrow in on a very specific. If you need 4.5 milligrams and you get the right product, you can get close to that. I know there's leeway, but you can get pretty close. Um, Ages 21 to 64 they're using everything.
Okay.
55% were inhaling, 55% using tinctures, 55% ingesting. So, of course, they're
Wow.
overlapping because that
Yep.
adds up to way more than 100%, right? 17% using topicals in older patients. So, patients over 65 years of age, and we had almost 300 patients in our population in that age group. Ingestion was the most common route,
Yep.
60%, followed by tinctures at almost 50% and inhalation at 42% and topical at around 20%. So what's interesting, and that reflects the idea that, again, patients are using everything,
Hmm.
right? So I need to go pick the kids up at school. My back is killing me. I'm not going to take anything by mouth. I'm going to rub some topical on my back. And within 10 minutes of being in the car, my back stopped hurting.
Hmm.
Right? So you want to have all these different methods available so that you can take advantage of um, the different ways that they work. I mean, that's really, if you're having a migraine, you need immediate onset. Taking a gummy is not going to do the trick. You're going to want to inhale, right?
Hmm.
And so I think because our patients are educated and they're not just walking into a dispensary, which, by the way, can be very intimidating,
Yeah,
especially if you're new and you don't know
sure.
what you're doing. Having some knowledge ahead of time, having an idea of what you should be looking for and what you should be, trialing first, also how to dose things properly. I think that makes a big difference. And I just definitely think it expands the experience for these patients. And I've said this again, probably after the first year of working in this field. I mean, it's really eye-opening for me because I was really deep into conventional allopathic medicine. It was eye-opening because patients were saying the same thing. What I saw was not so much that we're curing people, but we are giving them back control over their condition rather than their condition controlling them.
Mm.
And that changes everything when you are not feeling well.
Yeah, absolutely. No, and I think you're absolutely right in terms of the benefits of working with a provider is, I mean, it is that I think systematic approach that you apply to it of, okay, we're going to try this, we're going to titrate, we're going to evaluate and adjust accordingly. I mean, I don't know if everyone is going to have that approach if they just go into a dispensary and try to figure things out for themselves. So I think
That's
that's
right.
where
Yeah.
it's very
And
helpful.
and some some cannabinoids are not available in dispensaries. So, for instance, CBDV is cannabidivarin. It is a cannabinoid that's, was discovered, I think, in the 60s, and just no one really, went on. There were so many other things to look at, it kind of got left behind.
Hmm.
But very interestingly, and I'm not even sure if I'm correct on this, it's just what I've teased out from like looking back and looking at the research. It appears that somebody did their PhD thesis on CBDV for seizures in mice
Hmm.
and published this very promising paper, or their thesis, that showed that CBDV was a potent anticonvulsant. And then somebody else came along. I mean, this is what we're relying on in the research world, is somebody else comes along and says, oh, that's really interesting. Let me take it to the next step. And then looks at, and this was, by the way, in mice that has specific genetic variation that is the same kind of a mouse model of what we call Rett syndrome, which is a
Mhm.
genetic disorder that affects like one in, I think, 10,000 children, where they have normal development the first couple years of life, and then they start to have seizures and communication difficulties, motor difficulties, and it just kind of gets worse from there. And it's very challenging. Anyway, so CBDV was looked at in a few more studies of Rett syndrome in mice. And then somebody did a study on 5 little girls with Rett syndrome
Mhm.
in Australia and showed that there was a 79% response rate in these little girls with treatment-resistant epilepsy. I mean, one of the kids was having over 300 seizures a month,
Wow.
and it went down to, I think, less than 30. I mean, that is a massive change in that child's life and that family's life. I mean, if you're having 10 seizures a day, you really can't live life. I mean,
No.
that's that difficulty. So anyway, when I have my patients that have, and I read these studies and here's CBDV available, and I know that I'm kind of a neurotic, cautious clinician, I handpick a few of my families who are used to cannabis. They know how to dose it. They are stay in touch with me. I say, I know your child's on CBD and has seen a reduction in seizures, but still having some seizures. Are you willing to try something new? That I've bought the product myself. I tested it. I know what's in the bottle. Are you willing to try it? And I'm so glad that I did that, because I have a handful of kids now who had partial benefits with CBD alone, and we tried other cannabinoids and we didn't get benefits. And we added CBDV in, and some are seizure free and some are practically seizure free, or
Wow.
90 greater than 95% seizure free. This type of treatment allows these kids to live their lives,
Yeah.
and potentially, and I think only makes sense, especially if remember, children are developing brain development during these years. And everybody's always so worried about what's cannabis doing to their brain. What are seizures doing to their brain, right? I have a number of young adults in my practice who have been treatment resistant for many years, and they are now very disabled. And, one looks at, is it the underlying illness? Well, if it's never been diagnosed, it's very likely that it's the seizure disorder. And remember that it's 30% treatment resistance in children with seizures. That means 1 out of every 3 children that have epilepsy are going to be what we call, drug resistant
Mm.
or intractable. We must offer other compounds. So that's why, I'm always encourage people to at least seek a medical consultation at least once, get the education. It is worth it, rather than, one, having a bad experience, or two, missing out on something that's not even offered in a dispensary and nobody's even going to talk to you about it.
Right.
Right. So to me, it's now, if you're a person, like you said, not sleeping great at night, and I found my gummy that works, hey, great, I'm thrilled. I do not think we need to gatekeep,
Yeah.
but we
Right.
do need to educate. And that
Absolutely.
is part of the reason that we did this study.
Yeah, that's fascinating about CBDV. And and how it was so helpful with seizures. I've always said, and I talk to family, I talk to people at parties and things like that, tell them what I do, and if they're ever skeptical about medical cannabis, I always say, look into how CBD helps kids with epilepsy and seizures because I mean it's undeniable. And like we've talked about with
Absolutely.
anxiety and sleep, I mean, could there be some placebo effect in some cases? Perhaps, but
Who
I
cares
mean,
though if it's helping you and you think it's
exactly,
helping and you're not
exactly.
and not being harmed by it? I mean, how many things are placebo? We know that antidepressants are likely placebo effect for mild to moderate depression.
Yeah, but even if that was fueling someone's skepticism, I mean, you can't fake those seizures and the benefits there. And
And the children don't know what they're getting.
mm,
They don't know if it's an anti-seizure pharmaceutical or if it's cannabis oil, especially
right,
if it's put through a
exactly.
G tube or through a feeding tube or in a child that has neurodevelopmental issues. They don't know what they're getting. And when a parent says I literally have a family, they're on, when they came to me, they had tried 22 different seizure medications
Wow.
and CB and very disabled child. And the first dose of CBD that day, I think they all were walking around like, where's the seizures? Where's, and the
Wow.
mom describes that uh, she has two brothers, and the brothers are very used to helping her from the dinner table back to bed because her head would end up in her plate with her seizures, and they would help mom get her to her bedroom. And the mom described, she said, we're sitting at dinner and we're all looking at each other like, no seizure, it's not happening. And also, she reported it was the first week of CBD was the first time her child had smiled in years.
Mm,
And just think about that. I mean, that's, it brings tears to my eyes.
absolutely. All right. So I guess wrapping up here, are there any sort of conclusions from the study that good take-home message that we should hammer home?
Yeah, I think it's what I already said, which is if you are a person who is not finding success with your cannabis medicine, if you're having side effects, if you're nervous about trying it, if you are not sure if it will help with your condition, you should seek some professional guidance. And if I can do a little plug, I started a
Please.
company last year called Goldstein Wellness. So it's goldsteinwellness.com. And we have two parts to our mission statement. And the first part is education of clinicians. We do not teach about the endocannabinoid system in cannabis medicine in medical schools and in training programs. It is terrible that we don't do that because your
Hmm.
endocannabinoid system is basic to your well being. And how do we as clinicians just ignore a whole system and say, oh, you're not well because of X, Y, and Z, but oh, gee, it could also be an endocannabinoid system problem? So we educate licensed healthcare clinicians for free. It is free. Send your doctors, anybody that has a state healthcare license, acupuncture, nurse practitioner, DO, MD. If you are licensed with your state, you can sign up with us for free education. We are giving it away, and part of that stems from my own frustration when I talk with patients and I talk with medical colleagues. There's such a disconnect.
Hmm.
Patients don't feel that they're being heard, and the medical community is still somewhat skeptical and, still saying, oh, it's a hoax, and it's not. So please educate yourself. There's no denying what we're finding in our survey and what I've been living the last 18 years in my medical practice. So that's one part of the practice. And then the other part of the practice is if you are a patient looking to connect with a clinician, you can sign up for free. There's no cost to patients at all. You can sign up and we can refer you to either free, low cost, or a clinician that you can have an arrangement with um, to get medical care about cannabis. And again, even if you just have one meeting, it will give you information about whether or not it is appropriate for you to be taking cannabis, whether there's drug interactions with the medications you're already taking, and then maybe what cannabinoids might benefit you. And if you're working with a clinician, a licensed clinician, they can give you dosing and so on. So we offer that free service. And then we have a small marketplace of vetted products with medical discounts. Your doctor has to invite you to that. Your clinician that you sign up with has to invite you to that marketplace. But we also know that people are paying out of pocket for cannabis medicine. You know, I really believe insurance should be paying for it. We are keeping people out of the hospital. We're keeping children out of the pediatric ICU, right? We are keeping children with autism in school and in the home rather than being in a facility. So I really believe that it should be covered by insurance. But until then, we are offering that medical discount on vetted, tested products in our small, it's just, like I said, a small marketplace, but we have partnered with vendors who have been helping many of my patients for over a decade.
Yeah. No, and I think that's so important too, because there are so many products out there that you can find online, and there's a lot of great ones, and there are some not so great ones too. So
Right.
to have a place like yours that's vetted by a trusted professional like yourself,
Sure.
that's so
And
important.
they're just hemp. I mean, we don't have any THC products. We of course follow the law, and we want patients getting their THC products from a licensed dispensary that is testing and has an array of products to choose from. And also, our clinicians that are signed up with Goldstein Wellness are educated about the endocannabinoid system. They know what they're talking about. They're not
Right.
just there just to approve you and say, "Oh, just go to a dispensary and pick something." We give expert advice, and we help you find what works. We are invested in this treatment modality for our patients.
Yeah, I think that's an excellent resource. I know that you've been represented at CannMed before, and hopefully you have a table there again. Definitely put a link in the show description so people can check that out too, whether you're a clinician or if you're a patient. Um, and then the education piece, that's great, and it ties back into where we started too with the medical practicum.
Yep.
So if people want to learn more, definitely check out CannMed and come meet Bonnie and Dustin and Ethan in person. Be a great experience.
Yeah, please come join us. We'd love to see you. It's such a great conference every year. I love it. It's one of my favorites. And just the camaraderie and the networking and, you know, the ability to, for all of us clinicians, because, you know, we're all like in our little silos, and then we come out and we can share data, we can share experiences, we learn from each other, and then we're able to share that with everybody who attends the conference. And the other part I want to just say about the conference too is, if you're interested in cultivation, if you're interested in manufacturing, if you're interested in investing, if you're interested in other areas of the industry, that's all covered as well. It's not just the medical side.
Absolutely. We believe it's going to take everyone to
Mm-hmm.
push this forward and get it accepted, get insurance to cover it, and hopefully change some
And help
federal.
more people. Yeah, and change
Absolutely.
the laws and help more people. Unfortunately, right now we are seeing a bit of a backlash. We're
Yeah.
seeing laws changing, and it is absolutely not the right thing to do. We have an opioid epidemic. Nobody's even talking about that anymore. I mean, I don't know where that got lost in the conversation, but it did. And we have people still dying from overdoses, and it's just, there's no reason for it. And I have successfully transitioned many patients off of opioids onto cannabinoids, but I've also helped patients integrate cannabinoids into an existing opioid regimen, making it safer for them and making them feel better, minimize the side effects of the opioids, but allowing the cannabinoids and opioids to work together. That's another
Right.
whole talk. But at the same time, there's many different ways to do this. And so people should be open to the idea that, you know, cannabis is not the enemy. It has been vilified. I joke around, it's like a bad boyfriend. It comes with a lot of baggage. So,
Yeah.
or a girlfriend. But it doesn't deserve the baggage. And, you know, that's what we're trying to do, is to change people's understanding, but by leading with education.
Absolutely. All right, Bonnie, thanks again for the time today and sharing this information and talking about the practicum. And I can't wait to see you on the lake.
Yes, it'll be really fun. I'm really looking forward to it. What a beautiful setting too, Lake Tahoe.
Yeah.
All right. Thanks so much, Ben.
All right, talk soon.
Bye, everybody.